Okay folks, today's video is on how to do a blood smear correctly, and also afterwards we're going to stain. So as usual, we'll start with some of the things we need, and here we go, safety first. So some rubber gloves and some goggles. Always wear the goggles because if you've ever had a slide fly up and hit you in the face, then you'll know all about it, and there is a risk with the slipperiness of blood, etc. Then we need some slides, and I also like to use a straw, and we'll see why later. Capillary tubes is another option. Of course we need some blood there, and we've got a typical Diff Quick stain setup. I'll just put the Diff Quick stain to one side, so we've got a nice clean area. As you will know, all my videos always like to say, keep your working area tidy. So, first things first, let's get a couple of slides out. Always keep them as clean as you possibly can. I don't want them contaminated by touching other surfaces, etc. So, next, we need a blood sample. Here's one that we've taken earlier. This is in some EDTA, or an EDTA tube. First thing I like to do, and this is often missed out, is give it a really good shake. And ideally you want to do it for about a minute of vigorous shaking. What you want to do is you want to see these bubbles start to form at the top. So really give it a good old workout. Okay, let's say we've done that for a minute or so. Now, get one of your slides ready, and this is where, once again, a lot of people get this wrong. You can use capillary tubes to draw up a bit of the blood, but I like a good old bartender's straw because I feel that gets the volume that we really want from the blood. So that's how we do it. Lid off, pop your finger over one end of the straw, but just before you do that, actually introduce it into the blood sample. Then pop your finger over one end of the straw, and gently withdraw, and then you can just carefully release your finger at the top end, and hopefully we'll get a nice big drop of blood. Yeah, there we go, that'll do. Just to one side, but that's fine. So, that's the big drop of blood that we really want for this. Now, take another slide, and at a sort of 45-degree angle, you want to just push that in one swift movement all the way off the edge. Okay? Now, this is another point where people go wrong, and this is the one that you want to throw away. This is the one you want to keep. This is exactly what the pathologist is looking for. I can't tell you enough times how many occasions I've had this slide sent back to me and say, can you please actually give me the right slide? So why this is good is because, let's use the straw here, why this is good is you've got a thinning band towards the end, so you've got this thick bit here, and then as you get just towards the edge it starts to thin out. And what they can do is they can do two things. You can have a look in the thin area, and you can have a look in the thick area here, and that is the best area to work out the density of the cells within a decent volume of blood. And that's what the pathologist likes to look for. Okay, so that is how to do a good smear. Okay, the next step in the process is, now that we've got our good smear, is before we send it off, we need to kind of fix it in place, and then we've also got the option of staining it ourselves if we want. So instead of doing what used to be called air dried smears, what we need to do is use actually a heat gun, because we need to dry this as quickly as possible and at as high a temperature as we possibly can. So I use just a standard, fairly inexpensive heat gun, and pop it on the highest setting, and just start to heat that. And you can see already that the thin end is starting to dry. The glove here is thicker and takes a little bit longer, and when it starts to get so hot as you can't even touch it, now you're doing it wrong. Good. Excellent. Okay, so remember that this is going to be pretty hot, so allow it to cool before you handle it. Excellent. So the final bit in the process is if you need to stain it, is to get your diff quick stains ready. Now, if you're sending it off to an outside lab, you probably won't have to worry about this, they'll do the staining. But if you want to look at it inside or in-house, then you're going to have to stain it yourself. So diff quick stain comes in 3 containers generally. We have one which is simply a wash, the middle one is a stain, and the third is another kind of wash that just gets rid of excess stain. So take the lid off the first and just pop it in there, and because this is a wash, we want to just pop it in and give it a good old swill it around. What you're trying to do is any loose cells and loose blood cells there, you want to get rid of them, and just make sure that you've got a nice clean wash slide. Looking good. Right, next one. Remember, this is the stain. So, lid off and pop it in there. Like that. Oops. Cool. And pop that back. Now you want to leave that for half an hour, and that's how long it takes to take up the stain. So that's just going to sit there as it is. Okay, it's been half an hour. Should be stained nicely. Let's take out the yeah, that looks pretty good. Let's give it a dab on a bit of spare tissue. So now that we've got this stained, we got to wash off extra stain and possibly any other loose cells. So put it in there and jiggle. Good. Right, let's move the stains to one side. Pop this on a bit of tissue so you don't get any dripping stain everywhere. And now the very last thing to do really is to get it dry quickly. So we're back to our heat gun again. You can actually do this on a slightly lower heat this time, because all we're trying to do is just dry it before we send it off in the post. If you've got some big globs, then just shake them off. You can actually dab gently like that, and then just heat the rest. Great, well that pretty much concludes today's tutorial on how to do a first class blood smear and to then go on and stain it. I think any vet who needs to look at some blood under the microscope will be pretty pleased if you can produce something like this. So, thanks very much for listening. If you enjoyed this, give us a thumbs up. Also, subscribe please if you like it, and give me some ideas for future videos. Probably the next video is going to be how to save your practice thousands by making a homemade centrifuge out of an old record player, so be sure to keep an eye out for that one. Thanks very much.